We originally we had the first event kind of as a hybrid, but now due to circumstances, we had to go full online. So I'm at my home today, and I think most of you, everyone else is as well. Yeah, we thanks to new technologies, we're able to connect everyone here in this environment. So and it looks like we're succeeding so far. So yeah, I've just seen. Okay, so we have I see Martina. Uh, Zacchetti is online. I'm just seeing if there's anyone else from Italy, but for the time being, no. But maybe I think maybe it would be a good time to start. We're now at 11:02, so I don't know, Lana, what do you think?
Yes, I think that people can join, and when they join, if they need more instructions, then we can give it to them. So I think that we can start and then finish on time because everybody was counting with starting on time. So maybe just to say a few words. Hello, everybody. It's really, really nice to see you again on our third day of our kickoff event. And as Petya said, and Petya, I really love your comments. Thank you very much. I think that we really did it. And I think that we are going to do a great job today as well. And that we have shown that also online project implementation is very possible and can be done with a great success. Because even on the first day of our event, we achieved the number of the participants that we needed. So thank you very much for this participation. But of course, the content is more important. And I think that the topic that we have is very, very of a great importance to all of us. And that we are going to use the information that we heard from all of you regarding the volunteering work and solidarity actions in our future endeavors, and maybe even think of a new project, because we do have now the new program and the new perspective of Europe for Citizens. And I think that up to now, all of you have been really great partners, and I would like to thank you for that. With these positive thoughts, Mojca, hi. I see you now. Great. So I miss you all in person, but hopefully this moment as well will come very soon. I would also like to say hello to Željka Markulin. Hi, Željka. She's going to present today the new program and this new period that is coming within the program Europe for Citizens. So thank you very much for joining us. You are always a very, very nice guest to us. And I would also like to hear a comment from you. What do you think about these types of seminars online and implementation of our project in this manner? So maybe just short, but I think that I would hand over to Patrick, who is going to moderate this topic. Of course, I would also like to thank very much to Sunčica, who is also assistant on the project, because she did a great job. She divided you today in the groups, Zoom groups, so that we are able to work online in groups. Sunčica, thank you. And of course, Nebojša, thank you for great moderation of our groups and for great presentation. This is on behalf of our team, and of course, a great job last time to all of our partner countries. Eddie, hi, you joined now. Hi. It was just the intro saying thank you, so you didn't miss anything. You just came on time. Also, thanks very much to all the other participants that joined us, and I would like to ask you to stay tuned until the very end. Patrick, would you now take over? Okay, thanks.
Yeah, thank you, Lana. So maybe just to go over the contents for today, just to be sure that we're all on the same page. To begin with, what we're going to have is Željka will have a presentation, and she's representing the Government Office for Cooperation with NGOs. I believe that's the English translation. In Croatian, we say Ured za udruge, so the Office for Associations. would be the translation, and she'll be presenting about the new priorities, new programming period, and how it relates to projects like these, so similar to Europe for Citizens. After that, I'm going to be leading an online workshop, and it's divided into a few sections, and I'll be working with Nebojša as well. And in the first part of that workshop, we're going to be going over how COVID-19 compares to past pandemics. In particular, we'll be comparing COVID-19 to the situation in over 100 years ago, the Spanish flu pandemic. At the same time, so after that, we're also going to be talking about the similar challenges, similar solutions that were happening there. And then we're going to have a group activity where we're going to be divided into with our colleagues from our own countries to basically analyze a potential solution for an imaginary town called Borfume, or Borfume, whatever you want to call it. I made it up, but it's a scenario, and it's a situation that's actually being used in some places. So your task will be to decide on how the solution affects particular groups and why or why not they might be against it. And as well, we're going to be talking about how we can communicate with these groups and provide the appropriate messages. So that will be another part of it. And Nebojša, he'll also be going over a particular aspect that's very important these days, and that's how to communicate with people that are, let's say, non-believers. So there are quite a few these days when it comes to COVID-19. Many people believe it's a hoax or it's a conspiracy. So he'll be talking about how we should be communicating with these people and how we can get them on board when it comes to delivering solutions during the pandemic. Okay, so that's the outline of today's workshop. And yeah, I'll pass now to Željka. So Željka, welcome. And I think you have a presentation as well. So you should be able to share that presentation using the share screen option. Okay, so I'll mute my microphone now and take it away.
Good morning, everybody, again. Some of you probably know me from your last session. I hope you hear me well. I can't see you right now. I hope that I will, but still, I don't see the video anymore. So I will just keep talking because I don't see anybody complaining about my audio. So thank you again for having me today. Thank you for your kind words, Lana, and Patrick. It's also very nice to work with you again. I hope we will also continue our cooperation, of course. But to continue, I will give the short presentation about the new program that is going to be implemented in this new financial period of 2021-2027. And I welcome you, of course, as a contact point for Europe for Citizens program in this period. And I hope that this presentation will be useful for you and your future projects that you plan on having and planning to implement them in this new period. Just to start as an entree or something that will be maybe then clear to you what is happening in the new financial period. So we have a Europe for Citizens program, and if you do not know, there is one more program that is similar. It's called the Rights, Equality and Citizenship program. These two programs will merge with the Daphne program. This is an error from the period of 2007-2013. This program was not in this financial perspective, so that's why I just added it as a plus. So a Rights, Equality and Citizenship program, this is the REC program. It's the initials are REC. And they're combining with Daphne that was dealing with the battle against violence. So it's the new program of Rights and Values program. As you can see in the title, it says the perspectives of the future. So the Justice, Rights and Values Fund. This is because this is a new fund. So the fund consists from justice and rights and values. Justice is another program. It will be implemented by the Ministry of Justice. And hopefully the Rights and Values program will continue. We will continue to be the contact point for this program. As Euro for Citizens, this program will also be the program that will be implemented by the European Commission, of course, and the EACM, so the executive agency. You will see in the slides afterwards what are the activities and what it will be all about. But in the beginning, I just want you to say, I just want to say that the new program is because the commission, the idea of the commission was to combine or to have a new program. But still, the Euro for Citizens, as you all know, had this topic of cultural heritage in 2018. So the idea was at first to take the Euro for Citizens and put it in the Creative Europe program. But that didn't happen, and they merged these two, and the DEFNA program, as I said, that wasn't implemented in the latest financial perspective, but still it was for the some that know and that were dealing, that were dealing with the Daphne program that was the major activities were combating violence. They probably know about this program before. So just to be clear, and the Rights and Values program, this is also I have to explain a little bit more. Because the Rights and Values program, this is the program that is not still, we do not have the regulation for this program by now. So we are still in the negotiation process. That means that this title that you see is going to change in the slides just because nothing is really agreed on. So it could have some alternations, but I think that probably it will not, it will stay the same. So as I said, it is a big fund. So the Justice program will have $305 million euros, sorry, and the Rights and Values program, this was the amount that the Commission proposed. It was 640 million for this program. This is also a big issue in the Council, and not only in the Council, but also in the European Parliament, because there are some lobbying. Some lobbying is done about the amount of the fund of the Rights and Values program. Hopefully, it will increase. It's still ongoing. As I said, the negotiations are ongoing. We will see what happens, but I expect for this amount to get a little bit higher for our program. What will be the objectives? So I will just briefly go over strands that are going to be in the program, and these are the strands that are agreed upon. So the whole program wants to protect and promote rights and values that are enshrined in the treaties, in particular by supporting civil society organizations in order to sustain open, democratic, and inclusive societies. So the goal is really broad. It's always like that, and most of the things that you'll see in the slides are from the regulation proposal. So this is the only document we can work with now, and the only document that can tell us something that is going to be implemented in the period. So we will have three strands, that's for sure. This is the equality and rights strand, then the citizens' engagement and participation strand, and the Daphne strand. So equality and rights strand, it goes by its name. So equality and rights, mostly equality, gender equality, and all types of equality that you can think of. This is the strand that is going to have this topic. So for the first strand, it's only about the equality, and the second strand is the current Euro for Citizens strand. So you can see that in the regulation, the citizens' engagement and participation, this is something that the Commission left as a reminder that this is the Euro for Citizens within this new program. So we will have the second strand, and it will be completely as it is right now. So you will have the remembrance strand within, so it will just become the topic. So as now we have measures of remembrance, and then the civil society projects, then the network of towns, and then town twinning, they will all be in this strand. And then, as I mentioned, the deafness trend, combating violence. This is the new and the old topic. The Commission and thought it will be. It is very important to introduce the old topic in the new program. But I think that the situation regarding violence generally is something we really didn't solve. So I think it's really important, and I'm really glad that they put this new topic in the new program. To continue, so the equality right trend, I will not, of course, read to you. I just wanted you to have some additional information about what is this trend going to be all about. These are the activities, and as I said, non-discrimination, racism, xenophobia, forms of intolerance, homophobia, biphobia, transphobia, interphobia. I had the privilege to be in some of the negotiations about this program, and I have to say that a lot of countries are really keen and really supporting to put every type of as I said, the forms of our society's problems inside the regulation, so it will be really clear for the beneficiaries. And later on, when we will have the program materials, that you will see that this will all be the topics that will be covered by the calls for proposals. Also, as I said, the general idea is to promote equality, preventing and combating inequalities and discrimination on grounds of everything that is said here. But I think that this is mostly something that is really well known to all of you, because your organizations and associations or your work probably deals with some of these topics. That's why you decided also to implement the Europe for Citizens program. As I said, in the second trend, we will have all the activities that we are used to within this program, the Europe for Citizens program. So as I said, remembrance, so commemorating defines events in modern European history, then common history, culture and cultural heritage, diversity. So these are the big words that come from the regulation. Then the promoting citizen and representative associations participation in organizing civic life of the Union. As I said, this is more or less the same thing that was in the Europe for Citizens. I will be really quick about it. Of course, you will get the presentation, so you will have all the information inside. And of course, during this period, after the 1st of January 2021, you will be probably able to contact also the contact points and the contact persons within your country to get some additional information when the regulation is adopted and when the program will start. So the start of the program is 1st of January 2021, but hopefully I think that the first calls for proposals will probably be in the early spring. What activities will be funded in the area of remembrance? I just want to point that out, because in the presentation I just wanted to focus a little bit more about the Europe for Citizens trend, so the second trend. So I just also pulled out the part that is from the regulation, of course, that will cover this topic. So you can see that this is mostly the same formulations that we had in the previous regulation of Europe for Citizens, of course, in the program's documents. Also, in activities under the citizens area of citizenship. So it is really important that we will have the town twinnings and, of course, the network of towns, of course. But the town twinning was also very important to the Commission in the working group, I have to say, and because they want to leave this form of socializing and exchanging experiences in this really low intensity projects, as I can say. This is my opinion, but still they find it very important for people to exchange, to meet, and to say what they think and what they want. So the town twinning is really something that the Commission didn't want to change. And of course, civil society project as one of the most complex, of course, projects, but still with a really big impact, and of course the dissemination activities. Of course, network of towns is quite important also, but I just wanted you to see that these two were in some way a little bit more in focus when we were dealing with the regulation. So događanje trend, for those who do not know, so it's all about combating violence. So as I said, I won't read it, just for you to have some additional information about what is said in the regulation. So preventing all forms of violence against children, young people, of course, violence against other groups at risk, LGBTI persons and persons with disabilities. So every type of violence is covered. So this was also a big issue with the member states within the working group, in the council. Everybody was really keen on covering all types of combating against violence. In a way, we didn't really have any issues with these three strands. Everybody was really keen on having this program to spread and to introduce new topics and new measures. So this was really nice to see that on a European level, it was really, it was, complete. Everybody was really satisfied that the Commission has proposed a new program that is going to broaden, as I said, the topics and the trends. And then hopefully, of course, that we will get enough funds to fund every topic and to really have the program that reaches these goals after these 7 years. So this strand was not in the first three, as you could see before. So we had one new intervention during the negotiations, and it was the intervention of the European Parliament. So the European Parliament proposed a new strand. That's why it says here it's to be confirmed. So the Union Value strand. This strand should cover these topics, or this, as it says here, promoting and protecting, raising awareness of the rights and providing financial support to civil society organizations, active at local, regional, and transnational level, in promoting these rights. So the idea was the Parliament wanted to have the strand that will be mostly covered, mostly implemented by the civil society organizations. I can't really say anything more about this strand. This strand has risen some dust, as I just translated our Croatian. Sorry, I just hear additional voices. So this trend was a little bit tricky because some of the member states didn't want this trend to happen because they thought it couldn't be introduced in this program because it doesn't have the foundation in the treaties. And they have some legal things they didn't want this trend to be inside. But nevertheless, this trend was introduced, and it was, the Commission didn't have anything against this. The member states mostly were agreeing on having the fourth strand that covers these topics. It's connected, of course, with the rule of law and transparency and good governance. So in some member states, these are very delicate topics, and some of the member states didn't want this strand to be the part of the new program. But only a few of them, only a few states really were against. But still, it was some kind of a common understanding that this trend should be introduced only if we get additional funding. So every member state, mostly in the working group, so this I'm just talking about the technical level of the negotiations, were of course to introduce this trend, but then the overall budget of the program should be a little bit higher, because they wanted for other topics, as I said, that everybody was really satisfied with the proposed topics, should be funded adequately, just for the whole program to have its meaning and to reach its goals. So the union values trend was something new, and as I said, it's mostly about the civil society organizations for these topics, as you can see on the slide. But this trend will be only available for the member states. So this is the something new. So these three before will be you will be able to have partners, of course, from all European countries that will be the part of the program. They don't have to be member states. But for the union values trend, this trend will only be for the member states. And this is the big difference between the first three and this fourth trend. And as I said, this is something that will be still confirmed if it will stay or not. But there are some gossips going on that if this trend doesn't survive, then the topics will probably go in the Europe for Citizens trend. So the topics, as I said, so the things that should be financed. But still, I think that it will stay the same. So we will have 4 trends, and I think that we will get some additional funding, but we will have to see the end of the 2020. So if you're not so into the negotiations, you know, the multi-annual financial framework was just agreed upon in July, and now there are additional negotiations within the MFF are going on. So all regulations are on standby, not only for this program, but for Erasmus, for the Creative Europe, for all union programs, for the ESF Plus that is coming, and for all cohesion funds and infrastructural, everything that we know as EU funds and programs is on hold until some things on a financial and political level are agreed upon. So we will see about this trend, but hopefully it will stay. So I'm just going to point out that this is only for the member states. These are the activities that will be funded, and I hope that this is more or less very clear. The same thing that was funded even before. So awareness raising, training relevant stakeholders, mutual learning, exchange of good practices, analytical monitoring activities, ICTU tools, of course, national contact points as the end. This is something that we are also beneficiaries of this program, and we will be the beneficiaries of the future program, but all these activities will be funded within the new program. I hope that this is more or less clear. And as the new activities of the program, as I mentioned, this is mostly connected also for the union values trend, but it will be more or less across all other strands to increase the capacity to react. So this is a new thing, and ensure adequate access to all things to their services, counseling, support services, and advocacy activities. Advocacy activities are not so new, but they were not mentioned in this form. So you have to, of course, understand that this is a political document. So this is a regulation. So it was, we were, some member states really sensitive about the wording within the regulation. So advocacy in this form was not introduced before in the regulation of the Europe for Citizens, or I think for Europe for Citizens, of course, regulation, but even in some other programs. And now it's possible within this program. This is it. I will not stop now sharing my screen. I'm open for questions if you have any. if I didn't cover, of course, I will get back to Lana your question, of course, regarding your type of work and implementation of projects. I can only, of course, give you my personal opinion and my personal experience. But concerning the new program, of course, I'm happy to answer any of your questions if we have time. If we don't, you can always email me on our web, on my email, of course, and you can. I will post any new information regarding the new program, even within our website of Europe for Citizens that you can see on the last slide. And I hope it was useful for you. As I said, if you have any questions, I'm happy to answer. Thank you.
Patrick, can I just ask one question? Željka, thank you very much. I think that was very useful. It's always very useful to have such a structured program in front of us, because we would all like to continue with this program, which is really like very, very appealing to all of us, I would say. I just have a question regarding the other projects that are implemented within Europe for Citizens in Croatia now. Do you have any feedback from other implementation partners, how they are dealing now with the situation?
Well, not a lot of beneficiaries. You were I think one or maybe even one colleague from your neighbor town contacted me regarding the implementation of the current projects, because I can see your correspondence with the agency, and this is very useful also for me too. Okay. More or less all beneficiaries that could postpone their activities just postpone the complete implementation of the project. So, for example, I have one beneficiary that was supposed to implement the project in 2020, and they got funds in 2019, but they were supposed to implement this year, and they postponed it to 2021. Okay. So mostly it was done like that if it was possible, but still, as I said to Patrick and to you when we were talking, I have to say that this is a new situation for everybody. So I know it's really hard, and my only advice for you to just report every problem that you have or every thing that you will do differently, because I also do it. So I don't have any other type of work that I'm doing. I also had everything online, so I also wrote a very formal letter to the agency explaining that we are not going to do it as we thought, and that we'll do it online. And I have to say, for example, I have a lot of that I have my workshops, for example, and beneficiaries that I contact, and then when I had the official workshops, then I was using the old-fashioned way, and I was sending the promo materials by post, for example. This was my way of dealing with not being able to meet people, for example, but still, I have to say also that I find the agency very, very friendly, and they also told us they will just answer you case by case regarding the change of your activities. You all know that. I know that you read there, and this is the thing that they say to us as well. So I don't have any insight or any other information that I could share that could be useful. But I know it's quite difficult, and I hope that they will now, within the program, the program documents that are just going to be made after the regulation, they will have to put inside something that we can use if this situation prolongs, or if it just, comes back again, I don't know. And they have to prepare for this, because these are programs that are dealing with mobility. So we all should be there. So this is the good part, but this is the curse of the all union programs now. So it's just for you, it's maybe harder for you to do it like this, but still it's a way. I don't really have anything, but I hope that you will be able to plan and deal with your activities in a proper way online. I see that you're doing a great job, so I hope that it will stay this way.
Thank you very much, Željko.
Yeah.
I think that it was very useful because you just reminded me that actually now after the kickoff, my suggestion to all the partners would be, this is not the partner project, but we do have most of the all the partners here, is just to send a report to the agency and to see if we can continue working in this way. So basically, okay, thank you very much, Željko. We will include you into our activities in the future as well. You are, of course, free to stay with us until the very end if you want, or I know that you are also filled with work. So basically, also you can excuse yourself if you need to. But thank you very much. Is it possible to get your presentation, to share it with all the participants?
Of course, I will send Patrick my presentation just when I go offline. I will have to leave you. I really have to go, but of course, I really wish you good work. If you have anything to ask, as I said, and your colleagues, of course, they can write me in English or on any other of our languages. So it's fine, and I can even give them the information of their contact points if they need them. So
yes. Great.
Thank you again, and for you, of course, if you have anything that I can help you with until then, you can also phone me or
be sure we will contact you for sure. Okay, thank you very much.
Have a nice day.
Have a nice day you too. Keep safe. Okay, thank you.
Yes, thank you. Bye bye.
Patrick, please go on.
Okay, Željko, thank you very much. I must say that I was a little bit surprised to see the new combinations and the new changes, because I have worked on the Rights, Equality, and Citizenship program, and that is a very heavy program when it comes to the issues. So like a lot of the issues are domestic violence, the integration of migrants, racism, xenophobia. So these are not light topics for a lot of people. But at the same time, I was really glad to see that a lot of the ideas from Europe for Citizens are still going to be around, because there was some talk on message boards and things like this that Europe for Citizens would be totally scrapped. And I'm glad to see that it will be going on in a new form. And I guess we'll have to wait and see in January what application forms are going to be made out, what the criteria for applicants are, and some more specifics. But yeah, Željko, we really appreciate this presentation. It gave us some new insights. It gave us some new ideas on how we can proceed in the future with new projects. And yeah, once again, we really appreciate your contribution.
Yeah, I just want to add before I leave, as you said, this is the change. But as I said, of course, the change happened because the new program is now under a different DG. So now it's the DG of Justice and Consumers. And this is, as I said, like a political change, because it's not combined with the Creative Europe, but it's mostly combined with other topics that we're also that are also dealt with within the DG Justice. So this was the decision of the Commission. It's more heavy, and it's more, the topics are really sensitive, and you are completely right. But as I said, the cultural heritage, the heritage topics, and the Europe for Citizens as it is will stay. And of course, as the technical part, I can mention that now, because I know the lump sums will probably, stay. So you won't have any changes regarding that if you stay within the citizens engagement and participation strand within the new program. So nothing will change. So it just changed the title. If you stay within this strand, yes. And then
so
I will finish with that. Yeah. Yeah.
Okay, so the application process will be similar to what we
have. Yes. They will have a new portal, and the new portal will be for everybody, not only for you. It will be the new for me. They're changing the complete application process, but still it will stay the same. It will be easy, and this part will stay the same. They see that the benefits of the lump sums and unit costs, and the application is easy. They will leave that as it is. So you don't have to be worried about that.
That's good to know. Okay. Yeah. All right. Thank you, Željko. And
bye-bye.
Hope to see you again soon.
You too. Bye-bye. Bye, everybody.
Okay. Okay, I will now move on to the second part, and the second part is the workshop portion. So I'll now just go to my share screen and just see if that works. Oh wait. Right. Just one moment. Okay. Okay, I think I have permission. So, all right, here we go. Okay, I think everyone can see what I see. Right. And okay. All right. Maybe just to begin with, I just wanted to make sure if everyone can see this in the right way. So it looks like I'm in full screen mode. So yeah, everyone should see the initial part here. So okay. So maybe I'll just let someone yell in a second or two. All right. So okay. Now, to move on, we're going to be going over a few things. So I mentioned that the main idea of this online workshop today is to examine how we can include different groups in local actions during this difficult period. So that's our main general topic here. But at the same time, we're going to be discussing, first of all, the current state of affairs that we're facing here in Europe, as well as in other countries worldwide. And we're going to be comparing it to how things were done over 100 years ago during the Spanish flu influenza pandemic. We're also going to be focusing on how we can communicate with persons that believe that COVID-19 and all of this is just a conspiracy. So that part will be well, we have a contributor on that part, and that will be Ne Boysha from the Red Cross. So he'll be discussing some of his work methods, as well as some of the ways in which he's communicating with these groups. And to end off, we'll have a group activity as well as discussion focusing on a particular case study. So I've sent that case study to our project partners. So when we are in the different breakout rooms, you'll be assigned specific groups to examine and the case study. And then we'll take about 15 to 20 minutes to read over that and come back to discuss how we would communicate with specific groups and how we could possibly have a solution like this in our own files. And of course, we'll have closing remarks and conclusions to finish off the day. So first of all, I'm going to go into the situation concerning COVID-19. And this is as current as it gets here so far. So to begin with, how did it all happen? Well, it all originated in Wuhan, in China. And the first cases were recorded in November 2019. And that's why we have that COVID-19. Unfortunately, the Chinese government was unable to control the situation. In some cases as well, where information was withheld and some propaganda measures were taken. But the fact of the matter is that the situation got out of control early and it quickly spread to other countries. And then on the 11th of March this year, it was declared a pandemic by the World Health Organization. Since that time, so since all of this has started, the number of global infections is around 50 million cases, and it continues to grow each day. And right now, the number of deaths from COVID-19 is over 1.2 million people. So this is a very grim figure, and something that is something that is affecting all of us these days. It's definitely not a nicest of situations here. And currently, we're in the second wave, where infection rates are much higher than they were from March to May 2020. These are figures from the European Center for Disease Prevention and Control. and this is a European body that is monitoring COVID-19 within the European Union and in associate countries. And this was just from the weekend, and this number was over 9 million cases are currently being dealt with throughout Europe. But this number continues to grow because I originally prepared this presentation a week before, and the week before the figures were 8.5 million cases. So the numbers are continuing to multiply, to continue to grow rapidly each week. With all of this going on, there are huge economic and social impacts that are going on globally. Here's some of the quick figures that we can look at here. So first of all, economic growth is expected to shrink by the end of the year compared to 2019 by 5 to 7% globally. So all sectors are being hit by this pandemic in one way or another. Most of which are sectors that rely on person-to-person contact, such as the hospitality sector, tourism. These are the sectors that are getting hit the hardest right now. So, and these sectors, especially here in Croatia, where a huge portion of the country's revenue is built around tourism, this is taking a huge hit. Apart from that, the World Bank has reported that for the first time in over 2 decades, global poverty has increased by a significant portion, by 1% globally. And this is expected to grow if the pandemic continues in years to come. Apart from this, we also should look at social issues that are affecting us. The first thing I wanted to point out here is the number cases of mental illness are rising significantly, and it depends on the European country, and it depends on how harsh the measures have been. So we've all had to work with lockdowns. We've all had to work with, let's say, new regulations, measures in place for safety and security, which have taken, let's admit it, a burden on us as people as well. And in many cases, there are a lot more cases of anxiety, depression. It goes without saying that some of this is leading to higher rates of suicide, higher rates of basically conditions that are making us not so healthy. Oh, sorry, I hear someone. Oh, okay. Apart from this, another nasty thing, or a very shocking statistic has been the cases of domestic violence throughout the European Union. So depending on the European country, cases compared to last year have risen by 20 to 40% in European countries. So there is no unified statistic on this. So what I found was on a country-to-country basis. But in countries such as France, Belgium, the rates are between 30 and 40%. And as well, England is around 40%. You also have other countries such as Italy, Spain, reporting rates up in these figures, and a lot of this has to do with persons who needed social protection not able to get it due to the fact they had to stay in the same place as the person that was their abuser. So some of these measures have undoubtedly led to new social impacts that have had a negative effect on our mental health as well as on our physical security. So this is basically the situation in a nutshell. So what have we been able to do to try to go back to normal? What can we do to stop the pandemic? And this is a non-exhaustive list. This is just some of the main things I've researched and what I have found. But I'd like to go through some of them, and I'm sure that most of these are very familiar to all of you. So first of all, one thing was a global lockdown, and and we all experienced this back in March and April when things really started to get rough. Basically, we had stay-at-home orders, we had quarantine, we weren't able to go out unless if it was for essential purposes, and in some cases, you were only allowed out for a certain amount of time. There was curfews put in place in some countries, such as in Serbia. I know in Belgrade, for instance, that was a big thing. But anywhere I look, I have friends who live in, I have friends in Hong Kong. I have friends in Guatemala, in Colombia, in Vietnam. My sister lived there, and everywhere it was like this. It was empty, and this was something that was incredible. This was something that I really can't believe happened, because let's remember back in December and January, life was normal, and then all of a sudden life changed to this. Another measure that's been taken globally and in every country in the world has been information campaigns. And we've seen information being spread through radio, TV, posters, social media. And of course, here are the main messages that we're hearing every day. First of all, wash your hands, don't touch your face. That's one thing. I keep touching my face. I keep going, Patrick, why did you do that? So that's one thing we have all heard time and time again. Social distancing is something that we've been hearing time and time again, which is stay away from others if you can. So if these are persons that you're not in regular contact with, then you should keep a distance of 1.5 to 2 meters. It depends on which poster I'm looking, but now I think 2 meters is safer thing to say. The third thing, of course, is that this was a confusing factor at the beginning: wear a mask. When the pandemic first started, a lot of people were buying masks in vast quantities. And the message from health officials globally at the time was, don't do that. We need them for our medical professionals. But now, as research is getting more sophisticated and we're learning more about the virus, wearing a mask has become an essential part of daily life. So if we are in a social space, wearing a mask will protect us from contracting the virus. It's not 100% guaranteed, but it will definitely reduce the chances of you contracting this virus and having a big time illness. So wearing a mask has now become normal throughout Croatia and throughout European Union countries. And it's basically an essential part of life in Asian countries. My sister in Vietnam tells me that even when she's outside in the street, she has to wear a mask. Even if she's running outside, she's wearing a mask. So it's become very essential. Now, moving on, we're also resorting to restrictions and punishments. So we have, for instance, public events that must have certain limits in place. So limiting the number of persons that can attend, the number of persons that can join, things like this. So this is a normal place thing. So there's always going to be a limit. And we're seeing that limit being more, well, it's more and more strict as the number of infections rise. One thing in particular that was quite new in North America and European countries was registering in to go to certain places. So in Canada, for instance, in Quebec, one of the mandatory things for bars and restaurants is that each person that goes into the bar has to sign into the register. And if they're not going to do that, they can't go in. So that's a new thing as well. Another thing is staff. They must wear masks. They must keep distance. And as well, customers, clients, and everyone else must come into place. So if you're unable to wear a mask, or you're unable to, or if you forgot your mask at home, you're not going to be allowed into certain businesses. And I've heard that, for instance, in Italy, maybe Eddie can correct me later, is that I have heard that in Rome, for instance, if you are without a mask, the fines could be as much as 1,000 euro. So, the financial penalties are the way that things are going these days, and basically that's a signal that it's very important to enforce social distancing, to wear masks, to keep safe. Other measures that are taking place in different countries. Here's some other ones that I like to just mention briefly. First of all, we have drive-in testing. That's being done throughout the United States, Canada, and in European countries. In Zagreb, that's a very common measure that they have now. Social insurance schemes are being used in more developed countries to support those that lost their jobs. So of course, people have lost their jobs, they've lost their income due to this pandemic. And in Canada, for instance, there is a guaranteed income scheme that is being used. So if you lose your job, you are going to be guaranteed a certain amount each month. And in this way, and it's being done in Europe as well, but in this way, we're able to, let's say, reduce poverty and prevent people from losing their whole livelihood and becoming homeless. So this is an important thing that governments have done now, and it has helped. The other thing is curfew. So curfew in Croatian, I think it's called policajski sat. Basically means that there's limits saying when you can be on the streets. So for instance, if the curfew is from, let's say, 9 o'clock at night until 5 a.m. in the morning, if you're on the street at midnight and the police find you, you could be sent to jail, or at the very least, you will get a very big fine. So curfew means you stay at home and you're not allowed out in public. So it's a measure that is being used in some places, and it's incredibly strict. Of course, global travel is something that's being done. So if you want to travel somewhere, there's isolation measures. So everyone has heard about staying home or staying in isolation for 2 weeks before being allowed out and about in another country. So that's something that has really prevented any significant global travel this year. And yeah, and I, for one, was planning to do some traveling this year, but it hasn't happened. But this isn't a necessary measure in many cases. One example I can give you right now is the example of Canada and the United States. And right now, Canada has closed the borders to the United States, and this is the longest demilitarized border in the world. And Canada has basically said that the number of cases in the US is outrageous, and there is no way we're letting any Americans to come into the country during this point in time because of such a high risk of infection. So global travel has been effectively restricted due to this pandemic. And then other initiatives that we have had is, for instance, stay at home. So working online. What we're doing right now is a part of this. So conducting business via Zoom or Skype or other measures. And then, of course, we have volunteer-based initiatives, which we have discussed over the past few days. So now my key question is this, and this was something I was asking myself while I was doing this. Sorry, I hear an echo in the background. Could someone turn off their microphone, please? Oh, okay. So my key question now is, how are we doing compared to other periods? Are we doing anything differently? And here's the thing I compared us to. And we have, first of all, we have COVID-19, and we have the situation that's happening now. But we had a similar situation over 100 years ago in 1918. And I'd like to compare now how things were being done during the Spanish flu and how things are being done now. And I think we're going to be a little bit surprised. So one thing we have on the Zoom panel here at the bottom is reactions. So what I'd like you to do, if you want to, is to perhaps react. So I have a few yes/no type of questions, and basically I'd like you to say whether this was done during this period now, during COVID-19, or if it was done during the influenza, or perhaps both. So I'll go maybe piece by piece, and feel free to use the reaction section at the bottom to register your yes, no, or both type of answers. So I'll go on now. So first of all, here's some lessons from the past. So the first thing here is lockdowns. So I think we all know COVID-19 was, we had a yes, right? What about the Spanish flu? How many of you think that this the Spanish flu was led to lockdowns? No. Well, Spanish flu, yes and no. There were lockdowns at the local level, but there was never, ever a national level lockdown, and there was no global coordination system. So lockdowns were a very local phenomenon during the Spanish flu. So COVID-19 was a different thing. And it was this was the first time that we had the entire world, let's say, shut down business due to a disease. So in these times, this is quite a different scenario. Next, mandatory masks. So I think right now we know in COVID-19 that it's becoming mandatory in some areas. What about during Spanish flu? How was it then? I'll just give a moment if people react or not. Okay, so I guess not so many. Well, mandatory masks were a factor that were being used during the Spanish flu, and like it is now, there were penalties included in a lot of areas where people refused to wear masks. Now, moving on, information campaigns during COVID-19. We've seen quite a few of them. How about during the Spanish flu? Well, during the Spanish flu, there were also information campaigns. Now, moving on, this is another measure that was taking place, and one thing that has been argued a little bit as well, information suppression or withholding information. So during COVID-19, for the most part, I think information has been quite available, and health authorities have been very open about the disease, what it can do to you, and how to protect yourself. But during the Spanish flu, you had information suppression at a much larger degree. So information suppression, I have here COVID-19, yes, mainly at the beginning. So a lot of places were trying to hide this information from the public. So in China, for instance, when it first happened, people had no clue what was going on for the first month. So when the first recorded case came out, it took a little while before there was actually, let's say, admission in China that this is really a serious thing. But in the Spanish flu, information suppression was quite big, mainly because when it started in 1918, the First World War was still going on globally. So a lot of governments in England, France, United States did not want to create panic. They thought that people are already at war globally, and now they learn that there's some horrible plague going about, that they're going to freak out and destroy everything. So in a lot of cases, information suppression was being conducted. This was being done in Canada, United States, Great Britain, France, and elsewhere. And so a curious thing is, why was this called the Spanish flu? Well, the Spanish government, who was not at war at the time, reported the first cases, first publicly known cases were actually in Spain. But due to some, let's say, some forensics nowadays and some historical analysis, you will never believe where the Spanish flu originated. It actually originated in Kansas, in the United States. So there were cases of Spanish flu or influenza being recorded in a military base in Kansas. And the Americans unwittingly thought it was nothing at first. And these people were at a military base. So they went off to France and England and to the Western Front. And of course, the conditions there were horribly unsanitary. And that is how the disease, that's widely believed how the disease spread throughout Europe and throughout the world. Curfew. So we've seen this in some countries being initiated, and during the Spanish flu as well, this was initiated in a lot of American cities, in Great Britain, as well as in Germany, France. restricting the hours of shops and businesses. This is also something that we've seen during both the Spanish flu and COVID-19. So, and this is being done in order to reduce the number of people on the street, in order to reduce social contacts, and we've seen this being quite well. It has helped to, I believe, to reduce the number of contractions. Forbidding public events. So this is something as well that was being done during both the Spanish flu and as well during COVID-19. And here's a measure that we're all hearing. So nowadays we are hearing more and more about how it's important for us to stay healthy, to, let's say, eat more healthily, have vitamin D foods, as well as to basically stay physically fit as a means to have better immunity. So this is being done now, and during the Spanish flu as well, this was being promoted quite healthily. So one of the things in particular they had were, for instance, 15-minute organized walks in Great Britain. So they would have people organized in socially distanced groups and going out for a 15-minute walk to get fresh air and to get rejuvenated. The last thing is state support or social security for persons who were sick or who, let's say, lost their jobs because of the pandemic. So for the most part, we are seeing some type of social security and support for those affected by COVID-19. And here's the thing that's really different between us and then was that during the Spanish flu pandemic, for the most part, countries did not have a social security network in place, especially in the United States and Canada. Social security as a concept didn't really come into place in Western Europe and in North America until the 1930s. During the Great Depression. So, of course, during this time, 1918 to 1920, Social Security was considered a communist measure, and there wasn't any network in place for persons who lost their jobs. So, if you happen to get sick or lose yourself because of the pandemic, there was absolutely no safety net in most cases. So, so that's a big difference here. So here's some of the things that were going on here. So one thing I want to point out is that we have a lot of yes and yes for both of the things going on. So here's the thing I want to maybe point out in particular is that we are doing some things that that maybe we're not really learning from. So here's a quote from Henry Ford here, saying here, "The only real mistake is the one from which we learn nothing." And let's go through some of the pictures, and some of them I think you'll find quite informative and quite different. So the first thing is we're talking about information campaigns. So during the pandemic in 1918 from 1920, this is a typical poster you would see on the streets. You would see it in every community in North America. And it was also being done in other countries. So I'll just give you a moment here to just quickly read what they have here. So you might notice, and basically I would like you just to take a moment and read what's being said here. So I think now that you had a chance to, let's say, read this, a lot of the safety measures that they are promoting here in this poster from 1918, 1919 are very similar to what we have now. For instance, keep yourself clean, avoid coughs and sneezes, don't visit poorly ventilated places, keep warm, stay at home if you have a cold, avoid worry, fever, fatigue, things like this. So a lot of the safety advice is similar to what was being given in 1918 through 1920. A big thing that happened before the influenza pandemic was that a lot of people would be chewing tobacco instead of smoking. So there were a lot of people that spat. They were spitting, going like that. And they would do it randomly in public places, on the streets, on trams and stuff like this. So there were campaigns as well telling people to stop spitting. And in a lot of cases as well, they put in hefty fines if they caught you spitting on the ground in American cities. So this was another measure. This picture here was from San Francisco. Another thing that might look familiar here is the wearing of masks. This was something that was particularly enforced in the United States. And of course, with all the mask wearing, there were people that didn't follow. So one thing I wanted to point out here is we have a picture of a police officer telling a fellow citizen to wear a mask and to be diligent. So there were a lot of people that were against wearing masks and a lot of people that were for it. So the people that were for it were very, let's say, open about their views, as seen by this picture here where it says, wear a mask or go to jail. And in many cases, the fines were, well, there were fines in place for most people, which amounted to about $5 or $10. But in today's money, that would be something around the lines of, let's say, 500 euro, maybe even 1,000 euro, depends on where you're from. But there were penalties in place. But a lot of people refused to wear masks. And in one instance in particular, in San Francisco, a police officer was shooting at people because they were refusing to wear masks. So I guess he got so frustrated that he started to shoot his gun at people. So wearing masks is something that was a big controversy in 1918 through 1920 as well. And just like we have today, we have those who are wearing masks and those who are not. So we had, there was a term being used called a mask slacker. And a slacker is a person who refuses to do as they're told. They're not following the rules, stuff like this. And you also had an anti-mask movement throughout the United States and as well in European countries, in Great Britain in particular, where people would gather together and hear the reasons why masks should not be worn. And in this example here, so this is an example from the United States, where there were town hall meetings where people who were doctors as well as medical professionals would be telling people, don't wear a mask because it's unhealthy. So that's something in particular that's, it sounds quite familiar. Another thing as well is that conspiracy theories about how the Spanish flu began were spreading like wildfire throughout Europe and North America. And here are two examples that I have below here. So the first thing is, the main thing that came about was that most people in the United States and in, let's say, Western European countries were blaming the Germans for creating the virus. So there was a conspiracy theory being spread saying that this was a secret German weapon and that Bayer Pharmaceuticals was actually spreading it through aspirin pills. And this conspiracy theory spread even to the highest levels of government in some countries. So I have an example down below of a telegram that was sent to the Department of Justice explaining that German sympathizers and agents were spreading Spanish flu. And apart from that, there was also, let's say, caricatures and let's say news articles being spread. This was one example to the right here, stating that German U-boats were going off the coast and spreading it off the coast as a gas. So that way people were getting infected and the Germans were going to win the war. So this was something that was a big problem, and it wasn't really properly dealt with. And of course, there were a lot of German immigrants in places such as Canada, the United States, yeah, they of course did not, they always got the second look from other people whenever they were walking down the streets. Another thing too is that with the pandemic in 1918, there also came opportunities and fake cures and people selling what we call snake oil. So Some examples in particular. So this example here actually came out of the UK and was being used throughout Western Europe. And this was an air filter on the left side. And the basic premise of this is that this machine would clean the air and provide you with fresh, clean, non-influenza air. So that was the first thing going on. The other thing too was medicine, or let's say nutritional supplements. All of them were beginning to put on anti-influenza as a main way to get people to purchase the products. Of course, there was no medical evidence, no proof showing that it prevented influenza, but a lot of people were buying into it because they were desperate. So this was something as well. Another thing too was confusion. And I think we're all slightly confused about what we can and cannot do. And this was also the case in 1918 through 1920. So the poster that I have here, this was from London. And this was basically a cartoonist who was making fun of the health ordinances from the local authorities. And you might notice that some things are very familiar here. So avoid crowded streets. Don't get tired. Don't take the public transportation because you're going to get sick because everyone around you is a potential germ source. And they even went on to have a tower here saying planes don't come near here. So a lot of things were going on back then too, and a lot of people really didn't know what they could and could not do in the times of the pandemic. So I think the conclusion that we can make here, just by seeing some of the measures from 1918 and 1920, are that we're repeating the measures from the past for the most part, and in that way, we're repeating the mistakes from the past. So nowadays, I think we're seeing quite a lot of things going on. And I think that the level of misinformation and the level of conspiracy theories is incredibly high compared to previous periods, mainly due to the fact that information can spread much more easily than ever before due to social media. And also due to, let's say, politically motivated television stations and similar sources. So what I'm seeing here is that we are repeating some of the mistakes from the past and we're not really learning. So a lot of the situations we had are coming back. So what can we do as citizens? So I think some of the things we've learned over the past couple of days is, first of all, we should, first of all, think of the most vulnerable groups. So that means, like, let's say the people who really lost their jobs, have no income coming in, our senior citizens, people with large families, with low incomes, things like this. So we, as citizens, we can do things to help assist vulnerable groups. And I know that, for instance, the Red Cross is providing, let's say, psychiatric services. They're providing food donations. So things like this. Another thing as volunteers is that we can contribute our time and effort when we can to specific actions so that we make sure that our community can get through this. And then, of course, we need to be positive about things. So we need to think about what good can come out of our actions and what good we can do for the rest. So that's another thing that we can do here as well. But there's another thing I want to talk about. And that has to do with how we can contribute, be part of the solution. And I know that many of us in this audience today are with public institutions. We're part of associations. We're a part of NGOs. And one of the main things is that we got to think of our own ideas, what solutions can work, and how we can convert these new ideas into new actions, whether it be through projects, initiatives, fundraisers, and everything else like that. So we have to be active and we have to be ready to think of something new, something out of the box that can benefit our community. And my advice as, let's say, a project manager and whatnot is that you don't really know if it's a good idea until you say it out loud and talk to others about it. and try to get it in action. And that's what we're doing at Pučko Otvoreno Učilište, and that's what we know that your other organizations are doing here. So this is a key thing in order to get things going. And in this way, we can be active. But one challenge these days, and it's a very big challenge, similar to 1918, is that we always need to get the support of various groups. And getting the support of various groups can be quite a big challenge, especially now, especially where people have, let's say, specific opinions and beliefs about how COVID-19 started and how it will finish. So with that in mind, what I'd like to do now is transfer my time to Nebojša Bujanovac, and he will tell us about how they're dealing with let's say, persons with alternative opinions. So without any further ado, I will let Nebojša. I'll let Nebojša explain this chart and tell us about how the Red Cross is dealing with conspiracy theories.
Well, this is something that I would like to talk about because, just a moment, because there is a lot of people who are now conspiracy theorists, and it is a big problem because every such person is contributing to the spreading of the virus, of the COVID. So there are many people that do not believe that this exists, and many people who think that it's all a hoax, it's all invented. And as you see in this chart, this is a chart that was made by a student in USA. She has done it as her seminary work because she became aware that there are different levels of conspiracy beliefs. Some of them are even grounded in reality, as you see, because they were proven to be true. And others are very, very detached from reality. I will return to this chart later, but for start, I would like to talk about 6 rules when we talk to the conspiracy theorists. And the first rule is to be aware that it is a very difficult task because by definition, conspiracy theories are irrefutable. So you are not able to refute them because people do not believe in scientific facts, but only in the things they want to believe. The second rule is to recognize the emotional dimension, because conspiracy theories seduce people not so much through the power of argument, but through intensity of passion, of emotions. Underpinning conspiracy theories are feelings of resentment, indignation, and disenchantment about the world. They are stories about good and evil as much as about what is true. So, you know, tempers can flare and conversations can be very, very loud. It is important to prevent this from happening, so be prepared to de-escalate the situation and keep the dialogue going without necessarily giving ground. So this is the second rule. Third rule is to find out what they actually believe, because you know, there is a minority of committed believers who treat conspiracy theories as the literal truth, but many others might not see themselves as believers, but are willing to accept that conspiracy theorists might be onto something, and are at least asking the right questions. So you need to find out if you are talking to die-hard conspiracy theorists or someone who is, you know, maybe more reasonable, but has fallen to those theories because they sound probable to him or to her, okay? So this is the third rule. You need to find out what they believe. The fourth rule is to establish common ground. So, since those are not just political extremists or, you know, just die-hard conspiracy theorists, you will probably be able to find some common ground with those people. And this chart that we are showing you now will help you in this. So you can acknowledge that there were some conspiracies that were proven to be true, but also you can show them on this scale, on this chart, on this pyramid, that there are some conspiracies that are widely off. You know, they are denying science and denying the facts. So you will not be in position to be their enemy, just to be, you know, someone who seeks the real truth, the real facts. And this is the common ground with them. This is that we need to find, that we need to have with such people. Because many people come to conspiracy theories through genuine, albeit misguided curiosity about how to make sense of the world, you know. So they sometimes see themselves as healthy skeptics and self-taught researchers into complex issues. So do not criticize or do not mock them. Instead, present it as something that in principle you value and share. Your aim, after all, is not to make them less curious or skeptical, but to change what they are curious about, you know. The fifth rule, challenge the facts, but value their argument. So this is a two-pronged approach. The first prong involves challenging evidence and its origins, and you can address specific claims and discuss what constitutes a credible source. Offer to look at the evidence together, including on fact-checking websites, you know. So, but if you are talking to true believer, true conspiracy theorist, they probably won't ever engage with you on this. But if they have not yet fallen down the rabbit hole, as they say, they might, and this may lead them to start questioning their views. And sixth rule, we need to be realistic, because we will not be able to persuade most of those people, but when we get them to talk to us, it's a lot. It's a lot. And if we are able to do it through this conspiracy chart and to say, okay, some of your opinions may be grounded in reality, some are maybe less, and some others are very detached from reality. So this is something that we have in common with them. And in situations like this with COVID, it's very important to reduce the number of the people who believe it is a hoax and it is something that doesn't exist. One other argument is to show them your own case, to be the model. For example, I have COVID right now, but so I can talk about the symptoms of COVID, and I can tell you that they are not fake, they're not hoax. Of course, there are people who will tell you are telling lies, you are not telling the truth. But these rules are mostly for those who can be persuaded, you know, not those die-hard conspiracy theories, because it's almost impossible to talk to them and to change their views. So this is what I wanted to say about this. I wasn't long, I hope. Just try to remember these 6 rules. So the first rule is acknowledge that it is a difficult task. The second rule is recognize emotional dimension. Third rule is find out what they actually believe. Fourth rule is establish common ground. Fifth rule is challenge the facts and value their argument. And the sixth rule is be realistic. So thank you very much. It's the thing that I had to say in this, and Patrick, you can
Okay.
again, okay?
Okay, thank you, Nebojša. That, yeah, thank you for the 6 rules when it comes to this, and this is very, very big these days because I think all of us have met at least 1 or 2 people that have had, let's say, a very extreme opinion about why COVID-19 exists and how we're going to get over it. So I think it is important that we realize that yeah, we can't just change our minds immediately. We have to do it in a specific way. So yeah, thank you for that, Nebojša. Okay, now I'll just move on. So there was, okay. One other thing, maybe just one thing that came to mind as well when we were preparing this presentation is that one thing is, for instance, Newton's third law: for every action there is an equal and opposite reaction. So what I want to say with that is that basically you're never ever going to get 100% support for an action. There will always be a skeptic or a cynic or someone who will say that something won't work. So in my job in particular, if you have a project idea, some things that you might hear from other people might be, that will never work. That is only going to make things worse. What a waste of money. So I'm sure that all of you in your jobs or in your life have heard this, let's say maybe from family, friends, colleagues. There's always going to be someone that might be skeptical about what you're trying to do. So communications is a crucial thing, and the public needs to know why certain actions are being taken and what benefit the action has for them. So with that, we're going to be moving to the group activities. So we're going to be having that. And the basic premise of this is that we have a cycling association in an imaginary city called Borfume, or Borfume, as you can pronounce it as you wish. And they have a transportation solution in times of COVID. So basically what your task will be is to break into groups with your colleagues from your own country. So we'll have breakout rooms for Croatia, for Serbia, for Slovenia, Czech Republic, and Italy. And in those breakout rooms, I would like you to do the following. First, read the scenario. So maybe just a show of hands or a thumbs up reaction. So I just want to make sure that everyone has, so let's say Petya, Eddie, Martin, who else? Bojana, do you have the case study on file? Okay, that's the first thing. So look at that during this discussion, and then you'll also be determining the best solution for certain groups. So within the scenario, there's going to be a transportation solution provided, and you have several different groups that are affected by this. So there's factory workers and their union, factory managers, the city government, a tourism council for the city, the transportation authority, health authority, and then residents or citizens. So I would like to now assign specific groups to each one. So for factory workers and factory managers, I think first of all I'll assign that to Italy. So I'll put that in, maybe in the chat here. So Eddie, is that okay? Maybe I'll just ask to unmute.
Okay.
Yeah.
Yes.
So
yes, it is. Sorry.
yeah. So Eddie, in your group, you'll have the factory workers and the factory managers to deal with. Okay. So that will be for the Italian team. Okay. So now I'll go to the Slovenians. So Slovenia, in your case, I'll give you the city of Borfume, the representatives of the city, and we'll also have the Tourism Council. Okay. All right. Then we'll have the Czech Republic. So Martin, I'll have you have we'll give you the Transportation Authority. Serbia, we'll have you with the health authority or the medical community. And then at the end, so for Croatia, we have citizens of the city. So this includes a little bit of everybody for Croatia. So these are the main groups that we'll have to focus on. So now I'd like you to divide into your breakout rooms and to talk with your colleagues about the scenario provided. So I'm hoping that you can present that, and yeah, we'll come back as a group in the next 15 minutes to discuss what we found for each different group. So each group will present what their findings are. I hope that's clear for everyone. So maybe I can see a thumbs up or something like this.
Why you took tourism council from us?
You can do it. Look, if you have time, you can do it as well.
Okay.
All right. Okay, so it's clear. All right. So good luck, everyone. And yeah, on my side, I will share now the PDF file.
So see you later.
Okay.
Sunčice, jel mi ostajemo sad tu?
Ne, mi idemo u room Croatia.
Zove me pročelnica.
Patrick,
Who's this?
Tanya,
Ah,
you sent me the invitation earlier, but I left the room because I was too early. Can you send me the invitation to the Slovenian team again?
Sunčica, can you do that? Oh, just 1 second.
Sorry, because I don't see it anywhere. Where can I join the group?
Yeah, I have the same problem as Tanya. I'm also assigned to breakout room Croatia.
Yes,
Uh-huh.
and we have Dusan also, who needs to be in the Slovenian group. Dule.
Okay, there's an activation code. Is that what you need?
I'm also assigned in the Croatian group.
Aha.
Okay, now try.
Okay.
So guys, I will just wait you, Dule, Janja, David in Slovenian room. See you.
I don't know where to click to join you.
You have downstairs, you have breakout room.
Ah, okay, okay.
Look down.
Thank you.
Okay. All right. All right. 1 moment. Okay, I'll just get the file open. Okay, 1 moment, please. Oh, wait, there it is. Okay, I have it here. All right. Okay. There it is. All right, I am now sharing. So this is the scenario on the screen. So, mogu na hrvatskom sada, ako mi smo sve zajedno. Dobro, onda mogu vidjeti kak je situacija i mogu ići kroz toga i mogu reći što je šta. Onda ovdje je prvi dio i dobro, uglavnom mi imamo neki veliki grad sa 70.000 stanovnika i je slično kao Varaždina. Onda ima industrija, ima turizam i oni žele biti kulturna destinacija. I jedna stvar koja je vrlo bitna za ovaj grad je ciklizam. Onda imaju festival gdje svaki godina imaju oldtimer bicikle, imaju utrke na glavnom ceste, koncerte i BMX izložbe. Onda to je jedna velika stvar u gradu, ali naravno zbog COVID-a bilo je loša situacija. U 3. mjesec grad je morao zatvoriti. Škole su bili online i bilo je policajski sat nakon 8 sati na večer svaki dan. Dobro. Aha. Ok, dobro. I sada što imamo je situacija gdje naša vlada iz Barfume je morao zatvoriti grada jer više od 1000 osobe su bili sa covidom. I nakon 2 mjeseci od zatvorenja grad je bilo otvoren opet. I nakon 2 tjedna nije bilo ništa. I sada je srpnja ili 7. mjesec ove godine. I u jedan trenutak bilo je 100 novi slučaje od COVID-19. I to je bilo u zadnjih 5 dana. Naše doktore i liječnike su mogli naći, oni su mogli naći glavni izvor. I to je bilo busove i tramvaja u ovaj prevozni sustav grada. I naši doktori kaže da sve koji su bolesni sada su bili na autobusa ili na tramvaj. I zbog toga grad mora napraviti nove mjere. I mjere su jako strogi. Prva stvar je da svaki putnik mora nositi maska i također ima novi termalne kamere, tako da oni mogu mjeriti temperature. I ako putnik zaboravi svoje maske, ima velike kazne od 2000 eura ili više. I zadnjih 3 dana 7 stanovnika su dobili kazne. I još jedan problem osim novi mjeri je da nema puno busovi, nema tramvaj u operaciji, jer dobro, oni moraju instalirati nove oprema i zbog toga ima manje busova. To znači da ima više ljudi na tramvaju.
Patrik.
Yeah?
Oprosti. Sunčica mi je došla intervenirati. Ostao si u glavnoj grupi, trebaš doći u hrvatsku grupu.
Ok.
A što je s ovim kolegama koji su ovdje?
Ne zamarite se, oni su
Odi na breakout rooms.
Breakout rooms
i join breakout room Croatia.
Ja.
Ok,
join breakout room. Okay,
vidimo se tamo. Ok.
Bojana, još su svi izgleda u sobama. Ništa, imamo malo minut pauze. Ne vidim ostale.
Znaš šta, Mira se nije mogla javiti, sad ću malo ovdje da uzurpiramo, i onako nas ne razumeju većina. Mira je rekla, a šta je sa lošim vremenskim prilikama? To može da, znaš, to se mora spomenuti, ipak uzeti u obzir. Kupiti im kišobran, kabanice kišobrane.
Znam, zašto, što ima veze. Pa evo, Bože, Holanđani tamo voze i zimi i leti, voze ono decu, po onim imaš one kabanice, ne za njih. Mislim,
Jeste sve to, ali treba spomenuti, to prosto možda neće svi želeti da voze bajk. Ipak pričamo u Srbiji, na primjer, ne znam koliko bi pridobili.
Ne, pa znam, ali govorimo o zdravstvenom sistemu koji treba da to podrži. Po meni treba da podrži bez obzira na zdravstvene, na uslove. Još je gore da se ukrcaš u topao autobus, vas 50 tamo, nek da voziš po snegu. Bitno je da se održavaju putevi, da se obezbedi ta traka. Ok, idem sekund, ja probam.
Okay, hi everyone. Do we have everyone here? I think the breakout rooms have been closed now, so I guess we'll now go back to the scenarios. And what I'd like to just do is just hear from each group about what was found and what you think the best approach is with each group. So I'll go back to the presentation. And yeah, maybe to begin with, so we had the factory workers and factory managers. So I believe we passed that on to Eddie and his team. So Eddie, are you there?
Yes, here we are.
Okay. So when you and your colleagues were reading over about the factory workers, so and the managers, so would they be for or against this idea in general, in your opinion?
Well, in general, there would be, I guess, mixed answers. And factory managers, maybe factory workers coming from not too close to the city would maybe be not so happy to take a long journey by bike. But then we have to think of some benefits to try to stimulate them. The same for the factory managers, who initially may be, well, they may agree with the idea, but we thought that we could ask them to take part into some efforts together with the authorities to find some incentives and to make some shared efforts to ease their the participation of the workers. For instance, by sharing some incentives about the manutention or repairment of commuter bikes and on other efforts. I will talking about them in the next step. So generally, well, I think factory managers would agree, but not be happy to take a commitment or even some money to contribute in this. So of course they would need to have a contribution also by a stimulation and a contribution also by the municipality or the local authorities. And we thought about something we could suggest. Of course, the factory workers, so they would have mixed reactions, but here too, they could have mixed benefits. So they could be healthier. They could have some time to make some physical exercise instead of staying seated or on their feet on a public mean. At the same time, some incentive related to update their community bike, their commuter bikes, or even to repair them. And also, we would like to tell them that they could, for instance, save money on their public transport costs,
Right.
or their private costs. So, yeah, well, the message is that first of all, they should do that for themselves, of course, but also for the whole collective life of the city.
Okay.
What we have thought is that without specific incentives of several types, it would be hard to make them just accept this change.
Right. Okay. Thank you, Eddie. So there is obviously going to be a mixed reaction in any case. So we have the health benefits, but at the same time, getting to and from work could be a very tiring thing on bikes. So that's another thing too. So there should be some incentives perhaps added on. Okay, the next group, I'll pass it on to Slovenia. So we had the city government as well as the tourism council. So Petja or Mojca, maybe you could take it away. I think Petja is here.
Yes, Petja is here, and I was assigned again to do the talking. So if you let me again,
your favorite
word. So we believe that both City of Borfium and Tourism Council have agreed with the idea, especially Tourism Council, probably because it's even more promotion for the cycling in the city and for living a healthier life, and maybe even some promotion for the next year festival that will probably come if this virus goes away. And the City of Borfium also, because they need to do something about it. It's up to them to take measures, and I think, and we think in our group, that these measures were like soft enough so that people can actually also not only protect themselves and the others, but also benefit something from this cycling activity. So we say for the idea on the both sides.
Okay. Okay.
Benefits of the solution, definitely we can only see good things from cycling around the town. They are more or less already mentioned in the text, but just to go through with them. So stop the spreading, this is the main idea, of course. Then to normalize life a little bit as much as possible, to take the bus drivers at ease, because they have been very frustrated with people getting on and crowding there. So activate people to be more healthy in general, not only due to the COVID situation, to promote healthy living and healthy environment and being green and so on. And it's quite easy to keep social distance on the bike if you are not if you are not riding that two-seater bike. So I believe that they will be only one-seaters, and then you have no problems with social distancing. Of course, less pollution and the promotion of the next year's festival, of course, as one of the great things that Borfumo has done in the past. The message for the group, we thought that maybe we come up with some kind of a slogan that can be presented by City of Borfium or by Tourism Council. We don't have a perfect one, but one that could be used could be maybe cycle and stop COVID recycle.
Stop
like
COVID,
that.
recycle.
Yes.
Okay, I like it.
And I believe that both groups can use this slogan. I even think that the more unified the slogan is and the more unified approach they take, the more people they can actually get. And the slogan then is more recognizable by all. So Tourism Council and City of Borfium should spend some euros. They are already spending some on other measures. So this is one small thing that could be used to promote this cycling action in the town.
Okay, all right. Thank you very much, Petya. That's cycle, recycle, get rid of COVID. Okay, yeah, and definitely there's a benefit in the future for those cycling festivals. So yeah, all good. Okay, so now Martin, so maybe just to hear from you about the Transportation Authority.
Okay, I will let Stefania, my colleague, to present our group.
Okay.
So today I will act less as Stefania and more as the spokesperson of the Transportation Authority. And I'm going to present the main points of contention for which we are very much against the idea of abolishing public transportation and replacing the bus fleets with lanes for bikes. First of all, it is the very tight connection with the factory commute. The fact that the workers, they have a specific time for their shift, the fact that they have to arrive there in time, all of them at the same time, and the fact that having to commute by bike as a worker in a factory would also mean further physical strain for employees who might be already very tired. And also this brings the question of logistics. If the bus is being replaced by everyone having to commute with their bike, then on the site of the factory, you will have to either use existing land or purchase additional lots to create a parking lot for the bikes, because they will have to be stored there for the hours while the workers are on shift. So we consider that at least dedicated routes for the buses should be kept in place. We might concede to have giving away one lane for the bikes, but not both of them. And then the bus fleet also brings a logistical question. If the buses were purchased with public money and they're still being paid for, doing away with the buses means that maybe the local authorities will still have to pay for them, even though they're not in use. And if they sit idle, what do you do with the buses? Do you sell them, but you can't sell them if you're still paying for them? Do you just let them rust in one part of the city? So this would mean having to keep the infrastructure running. And there is also a democratic component to keeping the buses on the streets. Yes, in COVID times is not the ideal means of transportation with people clustering in buses, but consider those who might be less physically able or too old, or that 1 out of 10 who do not have a bike. What are they going to do to freely move within the city if the buses are going to be completely taken out? So this would mean denying the democratic aspect of mobility. And last but not least, if the buses or the trams are taken away, then this will mean further loss of jobs in times when the labor market is already affected by COVID. So in a city that is still quite developing, industrial, with a small demographic, keeping the jobs in this case would prevail over greening the city. And our final message would be, yes, we can go green, but you can't go home if you are one of those disadvantaged groups. So to conclude, we consider keeping the buses necessary for the city of Borkum to function, recover, and thrive.
Yeah, so that's definitely something that could happen, is that if you have some changes to the transportation system, of course, the Cycling Association will have some, let's say, extra questions that they would have to answer, such as logistics, what to do about older persons, and whatnot. We also had that discussion within our group about, okay, you have this, but what about winter? And I like your point about them spending all this money to fix up the buses, and then they have them, and then what? What do you do with them? So these are definitely questions that could come about. Yeah, so of course you have to think of other groups. Okay, thank you for that. So now I will move now to the health authorities. So I believe that's Svetlana and Bojana.
Yes, it's Bojana again. I'm like Petya. Okay, so basically we all agreed that the health authorities would be for this action, not against it. And we can immediately talk about the benefits of this solution to the group. First of all, they would realize that riding a bike promotes a healthier and more active life, and it strengthens immunity of their potential users and beneficiaries. Basically, riding a bike would reduce the pressure to the healthcare system overall in several perspectives. The first one being that when you are riding a bike, there are less traffic accidents, so there are less hurt people in their services in the hospitals. Then the most important thing, riding a bike is socially distancing, so there will be less COVID positive cases in the hospitals, which was their goal in the first place. And the third thing is that riding a bike is actually a good cure for not having depression and being happy. So when you are actually any kind of sports and riding a bike belongs to this, is actually good for people's mental health. So if people are more happy and they will be consequently less depressed, they would be. But this is not. I cannot claim this, but there are probably numbers somewhere and facts. But this is our conclusion. So if you ride a bike, you will be more happy, less depressed, and there would be consequently less cases of suicide and other cases of violence in the families and in the community overall. So definitely they would support this solution from more perspectives. Their message to the community would be, arrive to your destination, stay safe, healthy, and protected, ride a bike. But I have to say that I prefer and like Petya's message the most. So it could be applied to all those mentioned groups. So Petya, great title and the slogan.
Thank you, Bojana. And so now we have our last group, and that was us. And it was our group was the citizens of the city. And Nicolina, are you still here with us? I thought, because in our group, Nicolina had quite an interesting point that she made about the citizen. And,
yes, I'm here.
Okay, so Nicolina, could you just share your point that you made with us in the group about social marketing?
Okay. Yes, so basically what I do for living, I do marketing, and when it comes to situations like this, there is a specific area called social marketing, which means that in situations like this, you don't sell a specific product or service to customers, but you want to get a specific interest group to adopt a new behavior or to abandon a previous behavior. So this is called social marketing. And I actually have a book about it, and it's a whole theory how to handle this approach. But when we are talking about this scenario with the perfume, I was thinking that if citizens are if they think that COVID is not such a serious thing, there are no no serious cases, so they might be. Oh, there's some additional sound. Can you hear me?
Yes,
Okay.
it's okay. Yeah.
It's okay now. Yeah. I saw. I muted everyone. Okay. Okay. So my idea was that we could avoid the topic of COVID altogether, and to focus on creating the city of bikes. You know, because if we start a trend that people should use more bikes, people like to be part of trend. For example, we could record videos of people riding bikes, saying that they enjoy that they exercise in that way, they feel better. We could have events like bike fairs or festivals or manifestation where bike shops could give some discounts. So we could then we could support citizens to use more bikes, and avoiding COVID would actually be a side effect, which would actually be a accomplished goal that we want to achieve in the first place. So yeah, that's something. Do you want to add something else, Patrick, regarding our discussion?
No, I think that about covers it. I liked your approach of not labeling it as a COVID solution, but as something of just general benefit for the community, as something that would make the community more active, more friendly, more livable.
Yes, and it goes well with the, if I understood right, with the whole touristic strategy of the city to become the city of bikes.
Right.
So
right. That was another thing.
To remain city of bikes at least.
Yeah. Right. So exactly. Yeah. So we were talking about that, and the moment you might put a COVID label on something, then it could become conspiracy theory. So that's something that has to be taken care of. But yeah, maybe just to end off here. So of course, with each group, there's going to be people who are for and against, and there will be skeptics. So like the Transportation Authority, I think that's definitely something, because all of a sudden their main business model will change, and how do you deal with that? Another thing too is citizens. All of a sudden having to bike to work, that's a sudden shift. And as well, what happened? This is so in the scenario, it's July 2020, but what if the situation continues and then the winter comes? Biking in the winter in -2 degrees or 3 degrees is not so much fun. I don't know, Canadians do it, but it's not the funnest thing. But these were some things I just wanted to point out, and also give as a scenario. And now, one thing I just wanted to point out at the very end here is that this this scenario was something I based on from my experience in Colombia. So I lived in Colombia for over a year, and in the city of Bogota. And Bogota is kind of known as a rough city, but over the years, what they have been doing is opening up the motorways and turning them into bike paths on Saturdays and Sundays. So in this way, they're promoting a happier lifestyle, and it does make a difference. It's quite interesting to ride your bike or run, go for a run on a main freeway, and there's no cars. It's something that they do to clear up air pollution as well as to promote healthy living. But during the COVID crisis, they have been opening up parts of their city to bikes as well as to people running and stuff like this, so that some people who maybe have to go a shorter distance have an option to, let's say, take their bike, take their scooter or something like this, and make their way to work without having to go on crowded, congested buses. So that's what this is based on. So if you look up Ciclovia, so that's here in the bottom here, Ciclovia, there's more information about that initiative. But it has contributed to healthy lifestyle, environmental protection, as well as a more active and friendlier community. Okay, so I hope that exercise was helpful. And yeah, I thank you very much for taking part in this and participating. And I hope that you found these perspectives useful as well as the exercise. So I hope that basically this exercise helped us all realize that if we do have a solution, we always have to consider what the other side is thinking and how to communicate and react to them. So yeah, anyway, thank you very much. And now I'll pass the mic to Lana, who may want to say maybe a few words to end off the day and the event.
Well, thank you very much, Patrick, and thank you very much to all of the groups and all of the participants. I think that we did a great job. Maybe we should write, I don't know, a white book with solutions for social distancing that would not be so obvious, because I even heard that the term social distancing actually is not quite approved among people, because we didn't distance socially, but just physically. So basically, maybe that should be the starting point, how to calm down the people, because we are social beings, yeah, and we cannot take a social distance, because otherwise it would mean that we are not communicating at all. I think that you all agree. This is an interesting case that you presented, Patrick, and thank you very much for that, because we all do have huge factories, maybe not in our towns, but in very proximities. And I think that these are the issues that the owners and the managers are facing now. Maybe something that would be interesting to think about is how to cope with the working conditions within those factories. So this is something to think ahead for maybe next activities. But okay, we approached the end. Maybe some of our partners would like to say something and contribute to the closure of our kickoff meeting. Anyone? No? Okay. I know it's lunchtime. We don't have catering. I would like to offer you catering right now and invite you all for a nice walk through Varaždin. I truly hope that we will be able to do this. Thank you for all the compliments and all the comments on the great work we have done. As Željka said, I think that we are one of the few that are really implementing projects now that are based on the mobility. But I think that the important is that we stayed in touch and that we are really discussing our topics. So basically what I would like to say, we are going to contact the partners and start planning new activities very soon. Thank you very much for all your attention and great work that you have done. I wish you that you stay healthy and sound, and all of you that do have COVID now, please just take care and yeah, get healthy and continue to do your best, because this is the only thing that we can do. Patrick, thank you very much for moderation. Great work. And Nebojša, also, thank you very much for all the great work that you have done. You're always a very welcome cooperation partner of our institution. Nikolina, also, thank you for following us. Nikolina is actually, you know, our educator within the Academy for Entrepreneurship, but she's, now I think that I know you pretty much through the project, and I know what your values are, and therefore I'm also very happy that you are transferring these values to our entrepreneurs. So yes, I wish you a great, Sunčica, where are you? I don't see you here, but really she's doing also a great job. So thank you very much to all of you. Okay, if nobody else would like to say something, then I wish you a nice day and good luck for everything, and talk to you soon. And stay tuned, okay? Bye.
Bye, everybody.
Bye.
Bye-bye.
Bye-bye.
Bye.
Bye, everybody.
Bye.
Bye-bye.
Share screen. What do I have here?